Hello, everyone. We are going to go ahead and get started. This is Leslie Humble, the Senior Director of the Marketing and Communications team at Cure SMA. We welcome everybody and thank you so much for joining us today for our latest COVID-19 SMA community webinar. We are excited to see we had a lot of great questions submitted in advance of the webinar, and we're going to try to answer as many of these as we can during the presentation. We also have a handful of questions that we will respond to at the end of the presentation. You can also check the recently updated Cure SMA COVID-19 Information Center on our website. This presentation will be shared there as well, that you can let other folks know about it, or if you want to re-listen to anything following its conclusion. I would like to now pass this discussion over to Dr. Mary Schroth, Chief Medical Officer at Cure SMA, who will start with our medical update.
Go back one slide, please. Thank you. Welcome, everyone. I am Dr. Mary Schroth, Chief Medical Officer at Cure SMA, and I wish to welcome you all. Thank you for joining us today for an update on COVID-19. As an organization, Cure SMA is excited to begin holding in-person events, summits of strength, and walk and rolls. As we start to meet together, again, we are also considering and thinking about how to best keep the SMA community safe. There are some conflicting mandates and recommendations. It truly distills down to what is happening in the community where you live. And keep in mind that until more people are vaccinated, we will continue to live in up and down cycles with COVID-19. It is so important for us to gather, to connect, to share ideas and support each other. Our being connected as a community drives us all forward and keeps the momentum for progress in SMA support, research, and care. So again, thank you. Today, I will discuss the current status of COVID-19 across the U.S. A little later, Colleen McCarthy-O'Toole will discuss family support programs, and we will answer questions at the end. Next slide. So currently, COVID-19 vaccines are readily available to all who are 12 years of age and older. Approximately 56% of U.S. residents over the age of 12 are fully vaccinated. And this is not good enough, truly. It's just not good enough. The U.S. is opening up. The CDC provided guidelines that if you're vaccinated, wearing masks are optional. Next slide. However, we're seeing significant increases in new cases over the last 14 days. This slide shows you a map of states with just little snapshots. And on that right, that graphic shows you that for states that have red color, the darker the red, the higher the number of new cases in that state. And states that are green are having decreasing cases. So we're seeing a new surge of cases. And what we're seeing is that the Delta variant is predominant. 50% of COVID sequencing that occurred the week of July 3rd demonstrated that Delta variant was the COVID in 50% of cases. Just this week, that has bumped up to 83%. And we're concerned about Delta because it is much more contagious than any other form of COVID that we've experienced to date. In response, Los Angeles County and other areas in California, as well as other states, are mandating wearing a mask indoors, regardless of vaccination status. Next slide. What we're also learning related to the surge in COVID-19 is that 97% of people who are currently hospitalized with COVID-19 are not vaccinated. COVID-19 is becoming a pandemic of the unvaccinated. And this is a quote from Dr. Rochelle Walensky, the director of the CDC. And that is it's scary. It's a scary situation to be in. I will share additional statistics with you and information about where we are with COVID. So next slide. This slide shows you over time the number of new cases in the U.S. That are reported to the CDC. And in the yellow graphic off to the right is the number of people fully vaccinated, 7-day moving averages of total per each day. And what you're seeing is that COVID, we had at least 4 waves of increasing, and now we're starting what appears to be a potentially a fifth wave. As vaccinations went up, number of people being vaccinated each day went up, the COVID went down. And the lowest number in the last, year and a half was on June 20th. And since June 20th, we've now had steady increases in number of new cases. 60% increase in the past week, and the week prior was 69%. So we are getting into another time period of great concern regarding COVID. Next slide. This slide demonstrates the level of community transmission of COVID-19. Overall transmission across the U.S. is considered to be substantial. The highest level is red, and there are 7 states and 1 territory at the high level. 12 states and one territory are at substantial levels of transmission, and those states are represented in orange. 32 states are at moderate levels of transmission, and those are in yellow. And 1 state and 3 territories are at low transmission rates, which is blue. Overall case rate per 100,000 is 55 people. Overall positivity rate is 5.2%. And what that means is that when they do testing for COVID, screening for COVID, 5.25% of the tests are positive, and anything over 5% is concerning. And across these states, it's variable from less than 5% to 15 to 20% positivity rates. So great concern. And this is showing you also, we'll see in the subsequent slides, areas where vaccination rates tend to be lower. Next slide. So this is a breakdown by state of the COVID-19 positivity rate over the previous 7 days. And this is per 100,000 people. So the darker the color, the darker the blue, the higher the rate of people identified as having COVID. And the states with the highest rates currently are Nevada, Missouri, Arkansas, Louisiana, and Florida. Next slide. I want to take a side note here just to talk about the COVID-19 variants. There's more and more in the news about these variants, and they are a concern. And actually, the CDC has ranked the COVID variants by category. And variants of concern is one category. There's variants of interest, which is variants that are being watched, and then variants of high consequence. We currently do not have any variants that are considered to be of high consequence, but that may change. Viruses change or mutate over time just as part of being a virus, and they do that to better survive in our host. The current variants of COVID-19 actually are better at surviving in the human host than the initial versions or iterations, variants of COVID. So these are much better adapted to people. Because COVID-19 has continued to survive and circulate from host to host in the community, the opportunity to mutate is very high. On a positive note, the current vaccines are effective against the circulating variants. And I'll talk more about that when I talk about the vaccines. So just to briefly run through the variants that have been of interest, most recently is the Alpha variant, which began in the UK and was detected in the US in December of 2020. The Beta variant, which began in South Africa in December of 2020 also, and was detected in January 2021. The Gamma variant, which began in travelers from Brazil who were tested while traveling in Japan in January 2021, and it was detected in the US in the same month. And then the Delta variant, which began in India, was detected in India in December of 2020, and then detected in the US in March. Next slide. This slide shows you the distribution of variants circulating in the United States back in April up to July 3rd. And the Delta variant is the darker orange, and you can see that at the beginning of this graph, it was a very small slice. And now this graph is of July 3rd, it was not quite 50%, Now it's at 83%. So that variant has adapted, unfortunately for us, very well, and is the predominant strain. Next slide. This slide shows a summary of hospitalization rates across the U.S., broken down by ages. So again, you see the different waves of COVID represented here. What is of note is that people who are 65 years and older were the majority of individuals who were hospitalized, the age group that was hospitalized most frequently. And we're seeing a shift with this current potential wave of younger people, so people less than 65, and predominantly people between 18 and 49 years of age. So we're seeing a shift, and as information available about vaccination rates by age show that people over the age of 65 are vaccinated at a much higher rate compared to people less than 65. So, and that is reflected in these hospitalization rates over time. Next slide. So who's being hospitalized? 97% of hospitalized cases are in people who have not been vaccinated at all. And again, 99.5% of the deaths are among the unvaccinated. There's a larger percentage of people less than 65 years of age who are being hospitalized. Next slide. The current COVID-19 vaccines include 3 that have received emergency use authorization in the United States. Pfizer was the first vaccine and is approved for those aged 12 and older. It was approved in December 2020 and anticipated full FDA approval is planned for January 2022 at the latest. That is the deadline for when the FDA needs to make a determination whether it will provide full approval for the Pfizer vaccine or not. Pfizer has submitted that application. Moderna is under the emergency use authorization and is approved for those that are 18 years of age. But the Pfizer and the Moderna vaccines are both messenger RNA vaccines. Those vaccines do not interact with any of the treatments for spinal muscular atrophy. It does not interact with Zolgensma, Spinraza, or Evrysdi. The Johnson & Johnson vaccine is made a little bit differently. It's a non-replicating viral vector, so a small piece of virus that stimulates the immune system to make the antibodies is what that vaccine consists of. It is approved for individuals 18 and older. There was a pause on it for a period of time, but that pause was removed, and all 3 vaccines are currently available. Next slide. I wanted to review the side effects associated with these vaccines, but I also want to frame this up saying that even though these side effects are associated with these particular vaccines, the side effects and warnings are very, very rare. The complications of getting COVID infection, being hospitalized, and the long-term sequelae can result in similar complications as side effects of the vaccines, but occur at a much higher rate if you were to become infected. So common side effects of the messenger RNA vaccines, Pfizer and Moderna, are pain at the site, the injection site, tenderness and swelling of the lymph nodes, especially on the arm where the vaccine is given. Also, many people report headache, feeling tired, muscle aches and pains, nausea, vomiting, fever. And typically people report more side effects after the 2nd dose. So Pfizer and Moderna are both 2-dose vaccines. There are warnings that have been attached to these vaccines. The first warning is that there is a risk for severe allergic reaction, typically within an hour after receiving dose, if an individual is allergic to any of the components of this vaccine. Myocarditis may occur and typically occurs within a few days after receiving the 2nd dose. And this is inflammation of the heart muscle. Inflammation of the lining outside the heart, called pericarditis, can also occur within a few days after receiving the 2nd dose. These symptoms typically present as shortness of breath, increasing fatigue, and they have been well managed, recognized, and managed. And again, it's a very small percentage of folks that develop these consequences of the vaccine. Next slide. The Janssen or Johnson & Johnson vaccine is a viral vector vaccine, and common side effects associated with the single dose, and this is a single dose vaccine, are injection site pain, redness of the skin and swelling, also headache, feeling tired, muscle aches, nausea, and fever. Warnings that are associated with the Johnson & Johnson vaccine also include severe allergic reaction within an hour after the dose, and administration sites for the vaccine are set up so that they can intervene if this were to occur. There's also been a warning added to the label for the Janssen J&J vaccine. There's an increased risk for blood clots and low platelet levels within 2 weeks following vaccination, typically occurring in females 18 to 49 years of age. There's also an increased risk for Guillain-Barré disease within 42 days of the dose. This is a recent addition to the label for the Janssen vaccine. And Guillain-Barré disease is an autoimmune reaction that creates antibodies that attack the nerves of the body. And this is typically recognized early in intervention, and people have done well subsequent to having these particular consequences. And again, these consequences, side effects on the warning side are very, very rare. The common side effects, many people experience those and recover well. Warnings, very few. But I just want to bring it to your attention if you have not received a vaccine and you're wanting more information. I've received, so next slide. So now let's talk about the effectiveness of these vaccines. Across all three vaccines, they are 65 to 95% effective against symptomatic laboratory-confirmed COVID-19 when tested in adults over the age of 18 who received the vaccine, and 89% effective against COVID-19 serious outcomes, including severe disease, hospitalization, and death. So the vaccines aren't perfect. They're not going to prevent you from getting COVID-19, especially when COVID-19 is circulating through the communities. When we achieve a high vaccination rate, there'll be much less virus in circulation, as I would put it, and the transmission rate will decrease because there just won't be hosts that are susceptible to the virus. So with the vaccine, though, you are just at a much less risk of, number one, getting the infection, but it's not perfect. There are still people who get the vaccine and will get infected with COVID-19. However, they are going to have much less serious outcomes. The hospitalization rate is significantly less for those who have received the vaccine, as you can tell by looking at the numbers of people who are currently hospitalized and how many are vaccinated versus how many have not been vaccinated. And the vast majority are unvaccinated folks, and similar with death rates. Further effectiveness evaluation of the messenger RNA vaccine. So again, Pfizer and Moderna are that fully vaccinated people are less likely to have asymptomatic infection, which means that they're much less likely to transmit it to others who may not be vaccinated, such as their children or individuals under 12 years of age. So there's some reassurance there. The Pfizer vaccine effectiveness has been evaluated in individuals less than 18 years of age, at 12 to 17 years of age, and it is also highly effective for adolescents. Next slide. So this is graphs by state of vaccination rates. So on the left is percent of people receiving at least one dose, and the graphic end range is doses up to greater than or equal to 70% vaccinated in that state. The more blue the state, the higher the vaccination rate. On the right, percent of people fully vaccinated, with the top level being greater than or equal to 55%. So the darker the color, the higher the fully vaccinated rate. And you can see where those vaccination rates are: Northeast, West Coast, Midwest, and Northwest Midwest. And we have lower rates in the Southeast. Next slide. Before I talk about pediatric authorization, I've been asked what is an experience in the SMA community about receiving vaccines. We have heard that people have had adverse reactions outside of the common side effects of the vaccines. So we're not aware that anyone has had great difficulty. If you're watching this video and you've had great difficulty, send me an email. I'd love to hear about it. Send it to patientcare@curesma.org and let me know, because I've not heard significant complications as a result of receiving these vaccines. So one of the big questions now is, when are the kids going to get COVID vaccine? When will it be available for them? So the FDA requires more safety data for kids. They require 4 to 6 months of safety data. So after administering the vaccine, they want to watch those kids who received the vaccine for at least 4 to 6 months. Compared to adults, the data is for 2 months of safety data. So what we're looking at right now is possible emergency use authorization by midwinter for people less than 12 years of age, and it will be longer for children under the age of 5. We require that their safety data be for a longer period of time. Next slide. So one of the big questions is, what are we going to do about school? One of the things that we're learning is that in-school transmission reflects what's going on in the community. If community transmission is high and community vaccination level is low, then students and staff are much more likely to come to school while infectious and introduce COVID-19 into schools. And this is data from the UK, from the studies that they have done. Next slide. So school strategies that are being proposed are that, in addition to hand hygiene, all the basics, okay? Hand hygiene, good schoolroom ventilation, good building ventilation, regular cleaning of the school space, symptom monitoring, and 14-day quarantine for close contacts of a positive case. Schools must mask up. And this is being recommended by the American Academy of Pediatrics. They put out this recommendation in the spring, that all children who are not eligible to be immunized should attend school with masks. And we're aware that it's not required in many states, but I think for the SMA community, this is a very reasonable recommendation, that if you're not immunized, you're not eligible to be immunized, wearing a mask to school makes sense. Practice physical distancing, so 3 feet between individuals. And if there are cohorts, small groups of kids, there should be 6 feet between each of those cohorts, excuse me. And then also screening, identifying kids early, people who are infected early, so that we can contain the contacts. Next slide. So for vaccinated persons, there is it's called Zoe COVID. It's an application that is collecting information about symptoms. And for vaccinated persons, symptoms of COVID-19 infection that were reported through this app, again called Zoe COVID, they found that the -- 1 symptom was headache, -- 2 was runny nose, -- 3 was sneezing. And sneezing is an unusual symptom for COVID without vaccination. But it was reported that if you are sneezing a lot and it doesn't fit with allergy season, you should consider being tested for COVID if you've been vaccinated. Sore throat, loss of smell. If someone's had 1 dose of vaccine, symptoms for COVID infection, -- 5, loss of smell, is replaced with persistent cough. Persistent cough was much less dominant. I think it was symptom -- 8 for fully vaccinated people. So just to keep in mind, again, even though you're fully vaccinated, there is a risk of developing COVID or acquiring COVID because it is circulating in the community. And again, be aware of what your local community transmission rates are. Next slide. So for those who have not received the COVID-19 vaccine, access is now easy compared to where we were just a few months ago. A vaccine is free. If someone tries to charge you, that's totally inappropriate. It is a free vaccine. The CDC has set up a vaccine locator tool called www.vaccines.gov, which will identify multiple locations near you. Other location options are to look at the local public health website, talk to your healthcare provider, or also your local pharmacy may be offering COVID vaccine. And again, I'm pushing for COVID vaccine. I think that is what is required. Next slide. I got ahead of myself a little bit here. So how to protect yourself and your family, and especially children who are not eligible to receive this vaccine. Number one, get a COVID-19 vaccine. Next is wear a mask that covers your nose and your mouth to help protect yourself as well as others. Stay 6 feet apart from others you don't live with. Again, being cautious about people you may not know, and you may not know their vaccination status. Avoid crowds and poorly ventilated indoor spaces. It's preferred to be outdoors, to meet up with people that you may not know as well. Wash hands often with soap and water. Use hand sanitizer if soap and water isn't available. And we have personal protective equipment packages that Colleen will talk about in a few minutes that are available if you want them. Next slide. So I also wanted to provide an update regarding the COVID-19 impact on the SMA community survey. This is the third survey that we've conducted. It's still open. If you have not responded to the survey, please join us. What we're seeing is that the boxes that are green have shown improvement compared to the first two surveys, and boxes in red have shown a negative consequence or negative direction. So COVID has impacted the delivery of care with 32% experiencing canceled or delayed appointments, and this is down from highs of 39%. 18% have had their SMA treatment canceled or delayed, compared to a high of 20%, so that's also improving. 45% have had changes or limitations accessing services, for example, physical therapy, and that's down from 51%. 26% of respondents lost their job or had their working hours reduced, and that is down from 34% that was reported earlier in the COVID time. 64% were financially impacted. This is up from 45%. 21% were exposed to COVID or had COVID, compared to previous levels 5 of the first survey, 13% on the second survey. And that's honestly to be expected. 0.6% of respondents were hospitalized with COVID-19. And for this survey, there were 1,026 individuals with SMA or caregivers who responded, and over half were adults with SMA. Next slide. I just want to remind you that we have on our webpage a Cure SMA COVID-19 resources that please take a look at and send any questions to us at info@curesma.org. Next slide. So as Cure SMA is launching into in-person events, and again, we are so excited to gather and be together, to share, connect, talk. It's just so important. It helps keeps us focused. It helps us stay motivated. It's just wonderful. And I can't tell you how forward we are all looking to conference next year in person. But currently, so again, this is current. The guidelines for management of COVID exposure is changing over time. But currently, the preferred venue is being outdoors. And if you're vaccinated, wearing a mask is optional, depending on local guidelines. If not vaccinated, wearing a mask is required. Physical distancing will be implemented, and hand sanitizer and surface cleaners will be available. If we're indoors for an event like our Summit of Strength, everyone wears a mask, regardless of whether you've been vaccinated or not. Everyone will be physically distanced, and again, we'll have hand sanitizer and surface cleaners available. Next slide. And I'm so pleased to turn the rest of the next part of our program over to Colleen McCarthy O'Toole, who will talk about community support programs. Colleen?
Great, thank you so much, Mary. And thanks everyone. My name is Colleen McCarthy O'Toole, and I'm part of the support team at Cure SMA. Next slide. I just wanted to go over some of the support programs that we have available right now for the community. Many of you have already heard or received one of these COVID-19 PPE packages. They're wonderful. It's a box filled with antibacterial wipes, gel, gloves, there's a face shield. There's many great products in this package, and it's free. We are offering additional packages to you. So if you've already received this package once, please reach out to us again. We're more than happy to send you another one, especially with, as Mary was talking about, school starting up again and people vacationing. Just reach out to us. We will definitely send you more of these packages. We want to make sure that everybody in the community is kept safe at all times. Next slide, please. Again, what Mary was also talking about was our in-person Summit of Strength program. We're so excited to be live again with the Summit of Strength programs. We've held 4 of them around the country so far. We started at the end of May. As she mentioned, we do require all attendees to wear a mask at these programs, and we keep everyone socially distanced, and it's been wonderful. It's been great. Everybody is cooperating and having a wonderful time. These one-day programs have different agendas at each city, all different topics, everything from research updates, physical therapy, IEP and education, treatment updates, aquatherapy, all different topics, and people really enjoy them. They are free for all attendees, and they include free parking and free food. So if you're interested in attending one of these, please visit our website and sign up. The next one is actually next weekend in Kansas City. Next slide, please. We wanted to just go over some of the virtual community engagement programs that we've been offering over this last year. Since COVID started, we've offered so many different wonderful programs. Some of these, I just wanted to mention some that we have been having and will continue over the next 6 months. Things like our Adults with SMA virtual socials. We have Adults with SMA morning socials. We have held an entire wellness webinar series focusing on meditation and yoga. We have had a career panel webinar series, which we're launching again, and we're really excited about. We have our virtual therapy program where we offer for all adults with SMA virtual therapy through a Talkspace, through an online therapy source. And then we are also launching, which we're really excited about, we just announced it today, some in-person Adults with SMA socials. So those are going to be held across the country as well. And then we are continuing our physical therapy webinar series as well, which will just be launched within the next week or 2. Next slide, please. Some of our ongoing community support packages include the newly diagnosed care package that we send out as soon as the newly diagnosed family reaches out to us. It's an incredible package. The picture is there on the left of a baby with some of the items from the package. We also have 2 different teen and adult support and independence packages. These packages are incredible. There's a ton of different resources in each pack, and every new adult with SMA that reaches out to us is eligible to receive both packages. So they can receive the initial first support package along with the brand new independence package. Again, all you have to do is reach out to Cure SMA and we'll make sure and get those right out to you. Next slide. The last thing that I wanted to mention is what we're so excited about planning now is our 2022 annual SMA Conference. The conference is going to be June 16th through June 19th at Disneyland in Anaheim, California. We're so pleased to do this in person again. It's been 3 years since we've been in person, so we're super excited about it. Our registration is going to open very soon, so stay tuned on that. It should be within the next month or 2. as well as all of the scholarship information that we'll have available for everyone. But we're planning tons of new workshops, all different workshops, fun events. We're going to have a night at the park again, so it's going to be a great conference, and you don't want to miss it. So stay tuned for more information on the conference. And next slide. And I believe now it's over to Leslie.
Thank you, Colleen and Dr. Schroth. We're now going to answer just a few questions that were submitted in advance of the webinar. Again, we hope that we answered most of your questions as part of the presentation, but these are questions that either touch on additional topics or reiterate some important messages. So on the next slide, the first question is for Dr. Schroth. What are the recommendations of what people with SMA can start doing now when they are fully vaccinated?
Thank you, Leslie. So depending on your local guidelines, and it's really important to be aware of your local transmission rates and COVID new case rates so that you can make informed decisions about how to manage your exposures. But if you're fully vaccinated, ideally you can expand your social circle. You can be in small groups, ideally with other fully immunized people, and not wear a mask. Outside gatherings are preferred. I still caution you to avoid crowds. In situations where people may not be immunized, I recommend wearing a mask or avoiding altogether. Again, it's just so important to be aware of what's going on in your community, and ideally to be aware of vaccination status that people are willing to share, so that you can make reasonable decisions regarding, how cautious to be. But getting out into the community, I think people can start doing that with some caution. Things may change depending on what happens with this Delta variant and its spread throughout the U.S. Thank you.
Great. The next question is, what are your recommendations for fully vaccinated teens and adults with SMA being in close proximity with unvaccinated people, such as shared therapy sessions?
So this is probably a common occurrence, and it may be the situation that you're vaccinated and you just don't know about the other people who are in your group, whether they're vaccinated or not. And my recommendation is to wear a mask, especially if you're indoors. And the other option is to avoid those sessions. But if you're going to go forward with the sessions, again, wear a mask. Ask the other people if they would wear a mask. You don't have to know people's vaccination status to kindly ask them if they would be willing to wear a mask while you're together. The other is to be mindful of physical distancing, 6 feet apart, depending on your options for the space. But the bigger the space, the less risk of transmission. So it's caution, but wearing a mask to protect yourself, asking others to wear a mask, I think those are reasonable. Physical distancing, frequent hand washing. This has become a mantra about how you manage your exposures with COVID. Mask, physical distancing, hand washing, and outdoors. Thank you.
Great. The next question is about vaccines and treatments. What do we know about vaccines and treatments, including Zolgensma, Spinraza, and Evrysdi?
Great question. The Pfizer vaccine and the Moderna vaccine are both made up of messenger RNA. And this messenger RNA, which is the base of the vaccine, does not interact with any of the treatments that are currently available for spinal muscular atrophy. Similarly, the Johnson & Johnson vaccine, which is made up of a particular virus particle, that virus does not interact with any of these vaccines either. Zolgensma, which utilizes an adenovirus vector to deliver the medication, is actually different. It's an AAV9 virus and very different than the virus that is used in the Johnson vaccine. So the vaccines that are currently available, there is no interaction if you are on those treatments, receive those treatments, plan to get those treatments, or have ever received any of the SMA treatments, you can get any of the available vaccines. Thank you.
Great. Our last two questions are related to children. The first related to school. So is it safe for our kids with SMA to go back to school in the fall if other unvaccinated students wear or don't wear masks?
Great question. I want to tell you a lot about this. It's really taking into consideration a number of factors. The first factor is, what is the transmission rate in the community? We know that transmission rates within the school reflect what's in the community. So if there's a high level of COVID infection in the community, that's going to come into the school. So if you have high rates of transmission, high rates of new cases in your community, what you can do to protect yourself is to wear a mask, implement physical distancing, good ventilation. And even if you are vaccinated, I would encourage for those adolescents who have received vaccine to wear a mask if you have SMA. That will provide you with a very inexpensive way to protect yourself from the infection. So is it safe for kids to go back to school? The answer is it depends. What is going on, infection rate. And also, I really strongly encourage you to talk with your schools about how they are mitigating infection risk for those who are at greatest risk for severe complications of getting COVID. Thank you.
Yeah, and the last question is, yes, one more question. What is the latest information on COVID-19 vaccinations for children? You touched a little bit on this in the presentation.
So we are very hopeful that vaccinations will be available for the next age group, which we anticipate to be between 5 and 12 years of age, sometime midwinter. There's more information that's needed about the safety of the vaccines. For kids, we are always much more cautious when drugs and therapies are being approved for this group. So for the 5 to 12, the school-age children, we expect midwinter. For younger kids, less than 5 years of age, it will be later, possibly late winter, spring of next year. But we're hopeful. We're hopeful that that vaccinations will be available for everyone. Thank you. So with that, I want to thank everyone, and I will turn this over to Leslie in just a minute, but I personally want to thank you for joining us, for hanging in there through COVID, and we look forward to seeing you in person soon. Thank you. Leslie?
Yes, thank you everyone, and thank you Colleen and Dr. Schroth for going through all of that. We appreciate you listening to today's webinar. Let us know if there's anything we can answer, additional questions or needs, and if there's anything we can do for you, please email us at info@curesma.org, and we hope everyone has a wonderful day. Thank you.